As a cardiology nurse practitioner, one of the most common questions I get is, how do I know if I'm at risk for heart disease? Did you know that there's a free online calculator that can estimate your risk of a heart attack or heart failure? Most people have no idea it exists, and it only takes 30 seconds to use. In this video, I'm going to tell you all about it, but first, hello everyone, my name is Ray, and I'm a practicing hospital-based nurse practitioner specializing in cardiovascular disease. This channel is all about heart disease prevention as well as other topics on overall health and wellness. So let's get started. In today's video, I want to talk to you about an online tool created by the American Heart Association in 2023 that can be used to assess your risk of having either a heart attack or even heart failure. I'll place a link in the description to the online calculator so you can check it out. But in this online calculator, you can enter information on 11 metrics, which are your sex, male or female, your age, your total cholesterol, your HDL cholesterol, which is your happy cholesterol or your good cholesterol, your systolic blood pressure, which is the top number, your diabetes history, smoking history, your body mass index or BMI, your estimated glomerular filtration rate. This is a measure of your kidney function. You can get this information off of your blood work, either BMP, a basic metabolic panel, or CMP, or comprehensive metabolic panel. If you're on any antihypertensive medications or blood pressure medications, or if you're on any cholesterol medications. So when you enter all this information in, it'll automatically spit out a calculation that tells you the percentage of future risk of CVD or cardiovascular disease. It'll also tell you about atherosclerotic CVD, which is blocked arteries, and also heart failure. So who is this tool good for? If you're between the age of 30 and 79 without any known or established CVD, this tool is perfect for you. Who should not be using this tool? Well, if you do have established CVD or evidence of what we call subclinical CVD, for example, if you have an ejection fraction of less than 40%, that's the pumping function of the heart. Most of the time, you'll get that off of an echocardiogram or an ultrasound of the heart if you've had one. If you have a coronary calcium score of 300 or more, if you've had positive genetic testing for a variant known to be pathogenic or for an inherited cardiovascular condition, if you have end-stage kidney disease or renal failure, or if your life expectancy is less than 1 year, you probably should not be using this tool. So I went on there recently and I plugged in my numbers. For CVD, my estimated 10-year risk was 1.4% and 30-year risk was 10.1%. My 10-year risk of ASCVD or atherosclerotic cardiovascular disease was 0.9% and 30-year estimated risk was 6.3%. Finally, for heart failure, my 10-year risk was 0.5% and 30-year estimated risk of heart failure was 4.7%. This was actually interesting to me because I'm a person who, I'm pretty health conscious. I don't smoke. I don't drink much alcohol. I try to eat a healthy diet. I exercise quite regularly, and my numbers are not too shabby. But despite that, my risk is not zero or absent. So eventually going to develop heart disease at some point in our lives. It's not a matter of if, but when. So I'd love for you all to check out this tool and enter your information and see what your scores are. If you feel comfortable sharing, come back to this video and comment what your score was, and if you'll be doing anything differently now that you have that information. And with that, I'll start closing this video because time is precious, and I want to thank you for sharing yours with me today. If you have any questions about this or any video, feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by hitting the like button and subscribing to the channel. And make sure you turn on your bell icon so you'll never miss when I upload a new video. I want to say a big, huge thank you to all the current subscribers, all 482 of you. We are so close to 500. I think together I believe we can decrease the burden of heart disease one video at a time. By the way, I'm currently working on what will ultimately be a comprehensive guide to heart disease prevention, like a one-stop shop, if you will. So far, I've completed the first chapter, and I'm offering it to the first 1,000 subscribers free of charge. Just hit that subscribe button and send me a message, and I'll email it to you. While you're here, if you want to support the channel for free, please do me a favor and check out some of my other videos, like my video about sleep and how it can affect your heart disease risk. If you're a diabetic, make sure you check out my video, What Big Pharma Doesn't Want You to Know About Diabetes, which is a major risk factor for heart disease. I also have a video about something that nearly every woman will experience, perimenopause, and how hormone replacement therapy can impact your risk of heart disease. So if you've been thinking about HRT, please make sure you go check out that video. Anyway, I hope to see you in the next video. God bless you.